Participated on the agenda. Well, I'll start all over. Good afternoon, everyone. As a preliminary matter, this is Vivian Shu, Personnel Board Chair. Permit me to confirm that all members and persons anticipated on the agenda are present and that you can hear me. When I call your name, members, please respond in the affirmative. Richard Lanetta,
Here.
Joseph Herlihy.
Here.
Staff, when I call your name, please respond in the affirmative. Chuck Murphy Rumboletti,
Here.
Tatiana Swanson.
Here.
And I am confirming, Chuck and Tatiana, there are no other anticipated speakers for our open session.
That's correct.
All right. Let me introduce the remote open session. This open meeting is being conducted remotely, consistent with Governor Baker's executive order of March 12, 2020, due to the outbreak of COVID-19. The order allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will not feature public comment. Please note that this meeting is being recorded and that some attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you and take care that you not screen share your computer. Anything that you broadcast may be captured by the recording. All right, Chuck and Tatiana, I'll turn it over to you for the agenda, please.
Great. Thank you. Good afternoon. So the first thing on the agenda we have is the Schedule C, review for consideration of approval of Schedule C. So I will share my screen. Can you all see? Can you all see Schedule C now?
Yes.
Yeah. Okay, great. So as you know, Schedule C is the compensation tables for the part-time, seasonal, and temporary positions. What you're looking at now is the proposed Schedule C to be effective on January 1st of 2022. The current Schedule C, I'm going to try to toggle. Are you now seeing the Excel file?
Yes.
Yes.
Great. This is the current Schedule C and this is how it's been formatted in probably at least since I've been here, I think. And we've made adjustments along the way over the years. So the proposed Schedule C is slightly different in that, toggle back. Tried to put everything onto one page and to simplify some things. So I'll run through some of the changes specifically. And it might be easier to look at this crosswalk. So the crosswalk is the current title, the current rate, the proposed title, the proposed rate, and then if there's an increase, what the increase is. Generally, year after year, we will at least look at those positions that get affected by any minimum wage increases, and increase those positions accordingly, and any positions that they could bump up against. So this year, minimum wage is increasing on January 1st, 2022. So we had to do that, but also holistically, Schedule C hasn't been increased in at least 4 or 5 years. So the thought process with these revisions was to increase all of the positions by the same percentage that minimum wage is increasing, which is 5.6%. So you'll see a lot of these positions increasing by 5.6%. And then I'll go down the line at some of the other changes. So the activity instructors here, we're proposing a consolidation. You'll see there's activity instructors groups A through group M. And those are positions that in aging services, they'll teach yoga, Zumba, programs that generally they'll run 1 hour a week, 2 hours a week, things like that. or the Park and Rec Department will hire positions that run programs that are an hour or so a week. So the different levels are just different rates based on what the market's paying those type of instructors. So to give them the flexibility and to simplify things, if we just have one activity instructor and they'll be paid up to $80 an hour, but they can pick what the rate would be up to that, so that they have more flexibility in offering what the market's bearing for those type of instructors. The next change, the animal inspector. This role hasn't been filled. I went back through 4 fiscal years. This role hasn't been in effect. So that is being proposed to be deleted because it is no longer applicable. The election clerk, election inspector, and election warden, those are actually set by the select board, so there's no change proposed there. And those are paid on a per election day rate. The finance committee executive secretary, so that position was on Schedule A previously, but it has been a part-time non-benefit eligible position for the foreseeable past. So it's proposed to be moved to Schedule C at the rate with a 5.6% increase. The information technology specialist is obsolete and no longer applicable, so that's been deleted. The on-call public health nurse. I've had discussions with the Health and Human Services Director. So that position, there still is a need for on-call public health nurses. However, the rate itself is, it's a very competitive position right now, especially with vaccine clinics and things like that. It's proposed to do away with that position and to be able to hire at the SAS, which is another one of the positions that you can hire up to a certain range. So as needed, he will be posting for on-call nurses. And I would pin that to the range of the full-time public health nurse, but that would at least give him the flexibility if he's not getting applicants at a certain rate, he can go up to another rate to be more competitive. The biggest change on the Schedule C is the recreation specialist. So these are the seasonal positions in Park and Rec Department. And I had conversations with Stacy Mulroy, our our director of Park and Recreation. And she, having experience in other towns as a director, wanted to bring us in line with more comparable pay structure to those other communities, because the positions themselves have become much more competitive over the years in terms of rates. They've had a lot of trouble trying to hire swim instructors, swim lifeguards. They've had trouble competing with the state, which offers a sign-on bonus, including a much higher rate. So toggle over here. So what's being proposed is a new kind of separate schedule for the seasonal temporary positions that has different levels based on years of experience. And that will be a strict, they either will have to have direct years of experience working in Needham or another town in the exact position. And that would determine what their rate would be, along with these more specific titles. What we used to have was recreation specialist 1 year 1, 1 year 2, 2 year 1. So there was only 2 levels based on year. But in talking with Stacy, they really do, her employees generally, she has people starting out, the earliest she can hire them is at age 16. So she has people that might work 1 year of high school and then 4 years of college. So 6 years seem to be an appropriate step range. Sorry. 1 second. And go back to the crosswalk. So that is one of the biggest changes in this range. What else?
Chuck, where do the lifeguards fall in that new schedule in terms of position title?
Recreation. Yeah.
So the
Oh,
lifeguards.
there it is. Okay, sorry, I saw group leader. Okay, very
Oh, no
good.
problem.
And the
Yeah,
tennis
this year too.
and the tennis instructors, are they on the activity schedule?
Yes, the
Okay,
instructors for positions that are non-seasonal and that occur throughout the course of the year, those would be activity instructor group.
okay. So any of the other park and rec, outdoor, indoor programs? Okay, thank you.
Right, this is strictly the seasonal positions, which we have to get approved by the Department of Unemployment Assistance to be classified as seasonal.
Gotcha. Vivian, I got a question.
Yeah, and they can be pretty, they're pretty strict about it in terms of the number of weeks and the responsibilities. So I guess, I know in town, one of the concerns is can't Rosemary be open longer? So I don't know where that falls in under the seasonal requirements for the state to get approval.
That's correct. We have to get approvals soon after the new year.
Yep.
For those seasonal, and we have to, they actually require specific, that's another reason we listed out the specific titles. They require specific titles and job descriptions along with them as well. So yeah, they're very strict. I think we've gotten denied a couple of years ago for a few positions that they tried to do that for the pool for. So
Gotcha.
Yeah.
Chuck, a Vivian question. I understand that these positions are temporary, transitional, and the like, but did you run Schedule C titles through the new compensation classification system? And was any marketing research done, or were these positions kept out of that study?
Good question. The Schedule C positions were not included in the class and comp study. I think that goal a little bit further down the line is to get us on track with that now that we do have the new class and comp that's up to date. Sorry, we have someone in the waiting room.
Do you ever intend to run them through? Because I'm thinking that given the sensitivity of an hourly wage for a summer worker, might we have a marketing study to inform HR?
Yes, there was. Stacy did do some. She did do a survey of comparable communities to come up with these rates, and that's actually where these rates are based off of.
Okay.
At least the starting rates. And I'm sorry, there's a guest here I'm going to let in the waiting room. I don't know who it is, but. So yes, there was comparable communities were surveyed when coming up with the rates.
Great. Okay. And the position descriptions, they'll eventually all get thrown into the pot as well, or are you pretty confident they are in good shape?
The position descriptions, so for the seasonal temporary positions, those have been updated.
Okay.
I think each year we have to submit them to the DUA. They take another look at them. But so we'll take another look at them this year, but
You confident they're in good shape before we hit the ground?
Yeah, I
Okay.
do. I think they are. Yeah.
Okay. Good.
Chuck, did you say that we have a guest in the meeting?
We do.
Okay.
We have yes, Michael Ruddy.
Mr. Reddy, would you identify yourself for the record for our minutes, please?
Yes, can you hear me?
Yes,
Yes, Michael Reddy of 69 Melrose Ave.
thank you.
Thank you.
And so those are the biggest changes. The last, let's see. The last change here with the substitute inspector. The substitute building inspectors have been also a hard position to recruit for as well. With the private sector, and really they're on-call positions. So we've consolidated the wiring inspector, the plumbing and gas inspector, and the building inspector as just substitute inspector, applying the 5.6% increase. And actually using some of the data from our class and comp study, the full-time plumbing and gas inspector, the full-time wiring inspector are actually at a higher classification than the local building inspector. And in the previous Schedule C, those positions were lower. So we brought them all in line. And that rate of $30.10 an hour fits within both of the ranges for those positions within the full-time class and comp schedule. So just a consolidation there.
Gotcha.
And those are the biggest changes. And then so in keeping in line with the seasonal temporary, we've also added the labor or trades assistant to that schedule. Those are not seasonal per the definition of DUA, but they are only hired at a certain times of the year. And they are also based on the same criteria of having 1 or 2 or 3 or 4 years of experience. And same with the student intern and seasonal driver traveling meals.
Gotcha.
Any
And I
questions?
see the starting rate for the seasonal temporary is a little bit above the anticipated increase in the minimum wage for January 1,
Right.
right? Okay,
January 1st, it'll go to $14.25 an hour. And then there will be another increase the following year.
okay, yep. Thank you. Any questions from the board members?
No, no further.
Okay. Tatiana, did you have anything you wanted to add?
I do not, thank you.
I'll entertain a motion. And this is going to the select board for approval and adoption. Is that correct, Chuck?
That's correct. Yep.
Madam Chair, I'll recommend that the Personnel Board recommend adoption of Schedule C.
Thank you.
If I can get unmuted, I'll second it.
Very good. All in favor?
Aye.
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 None opposed. No
Thank you.
abstentions. Thank you. That was a very thorough explanation and I appreciate the work. It's a nice new format for the
Yeah,
schedule.
I agree.
It's a lot
Yeah.
easier to organize and read than what we've had in the past.
Yeah. Thank you. Thanks. Yeah. It's nice to have it all on one page just from an
It
estimate
is,
point.
it is.
Yeah.
So the only other thing on the agenda tonight was the military leave policy. It's not quite ready
Okay.
what to consider at this point. Still working with town council to ensure we are in compliance with state law. So just on a couple things, and we should have that ready for the next meeting.
Okay, great.
Okay.
And that will, I'm gathering that policy will also bring in provisions that are in the FMLA or the PFLMLA policies with respect to medical leave, correct?
Yes, I do believe there is a section in there about that. And there is as well in our FMLA policy. So
Great.
absolutely.
Good. So for our next agenda, you'll include that as well as the new RE topic.
Yes. Yes.
All right. And you'll let us know where the grievance stands.
Yes, I will. Hope so. At this point in time, we will postpone this hearing. We don't have a formal withdrawal yet, but if
Okay.
it gets worked out, the plan would be for the union to formally withdraw the grievance, and then the matter would be done. But if we do need to reconsider and repost the hearing, I'll let everyone know.
Do you have what is the time requirement going to be? I'm just considering the holiday schedule and other town commitments.
Sure. So the request from the union was to postpone for 30 days. That puts
Okay.
it to Christmas.
All right.
Perhaps we can, if it's still on, if it's still an issue at that point, we can, I don't know what your all schedules like. Maybe we should try to shoot for after the first of the year.
Okay.
I can send an email and poll everyone's availability.
That'd be fine if you want to do that. You know, you've got the other two items and I anticipate we'll have some others in the new year.
Yeah, I'm sure we will. So,
Okay, great. I think the only thing I'd like to ask you and Tatiana to do in conjunction with Kate and Katie is also to come to us with things that you think will be personnel related or HR related in terms of your 2022 strategic planning.
okay,
Give us a lens on where you think the year will go.
sure. So a year outlook.
Yeah. Yeah.
Sure. Yeah, I think that's a great idea. We can do that.
Okay. And then do we have any classification or compensation studies that are coming up for 2022?
We do not.
Okay.
So with the study that was just done, BCTIA, the Custodians and Trades Union, was the only one that was not implemented yet.
Okay.
And they have a contract coming up at the end of the year. So the hope is to get that involved in their negotiations for January 1st of 22. But that would be the only foreseeable one.
Great. Thank you.
Sure.
Chuck, as you're putting together budget for 2023, I know comp and classification was a biggie expenditure, but that's behind the two of you. Any large expenditures coming up?
On our end,
Yeah,
our office budgets is pretty standard.
okay.
Nothing there. We don't have any capital requests. Warrant items. Benefits wise, nothing substantial. No, I don't think
Okay.
foreseeable future, no.
Still staying with the same group, health group, Metro West?
Yep. Yes. So one change with the health insurance is Fallon Health Group is Fallon Community Health is not offering commercial plans anymore.
Ah,
So they will no longer be in a plan option. So we're going to see some migration from all those Fallon members to some other plan.
what will that do to rates that an individual employee is going to see? Was Fallon cheaper than the other
Yeah,
health we offer?
Fallon is the lowest cost plan. Yeah, so there will likely be, the Fallon members will likely have to see some increase and switch to the other plans. So at the West Suburban Health Group, some pre-adjustment has been done to the rates before we do rate setting for the next year. So Blue Cross might be now the new lowest option, lowest cost option. And we're trying to set rates earlier this year, so we should have new rates by the first of the year. So we'll know exactly how the jump is for the Fallon members.
Tell me again when open enrollment is for the town?
It's usually mid-March to mid-April.
Okay.
I think the one thing from a cost perspective for the town is that some of the other West Suburban Health Group communities had structured their contributions to health insurance offerings. So that Fallon was the most advantageous plan for their members. So there's 3 communities in the group that have by far a majority enrollment in Fallon. And they're seeing substantial increases to both members and the town itself. Needham has primarily Harvard Pilgrim enrollment. So our cost should be less substantial of an increase overall.
What percentage are with Harvard and what percentage are with Fallon? And Blue Cross?
I want to say Harvard's around 30%. Fallon was at 15, maybe.
Okay.
And Blue Cross was close to that.
Sure.
So what's that leave left?
Well, getting the rates early will help
Yeah,
town employees try to make an assessment if they have to make a switch from Fallon. So that's good.
yeah, it will require it'll require substantial enrollment
Yeah.
on our end this year because a lot of new paperwork, a lot of educating employees. To get the Employee Insurance Advisory Committee with the unions together just to inform them of the changes. So it'll add some work to our open enrollment process this year for sure. But education is the biggest piece. So we just want to let members know what to expect.
Yeah. Is that big bump leaving Fallon going to impact union negotiations for the negotiations right now that are going on, or no?
No, we won't have to negotiate anything with this change.
Okay.
Yeah, no, we won't have to.
Okay.
Would you circulate those rates when you distribute them
Sure.
to staff? That'd be
Absolutely,
helpful.
yeah.
Great.
Let's ask a really stupid question. Now that Fallon is gone, are any of the other carriers staying the same, or are they all going to go up?
So the Blue Cross will most likely be now the lowest option.
The lowest? Okay.
Yeah, and right now it's I think it's the second highest cost option. But some pre-adjustment prior to setting rates for next year.
Okay.
Doing they're calling it a business exercise where we're lowering the Blue Cross rates before we apply the increase for next year, so that we're providing members with a low cost option that's semi-comparable to Fallon. Because if the rates were left the way they are now, Fallon's so much lower that,
Maybe through the roof.
yeah.
Okay. Yeah.
But we'll see what works out in terms of claims. I think there's a lot of unknowns there. If the Fallon members were healthier, if their claims get dispersed to other insurance carriers, will that lower some of the cost of them? In theory, it should, but yeah, time will tell.
Okay.
Good.
And you probably said this and I just missed it. When will we know all of this? When will it come up?
Rates.
Hopefully by the after the new year. We're holding a West Suburban Health Group meeting in December. Usually we don't set rates until March.
Okay.
But the hope is to be able to set rates in December, and if not, sometime in early January.
Gotcha. And we're community rated, are we not?
Sorry?
We're community rated as opposed to claims driving our premium here in the town of Needham. So we're community rated, which means we really have no control. Our claims really don't affect the rates. The rates of the
So the claims go against the whole group. So the
Yeah.
11 member communities in the West Suburban Health Group all pool together, and
okay.
all of our claims get accounted for in the rates.
Yeah. And does West Suburban offer any wellness kind of discount to towns? If we went gun ho into helping our employees be wellness driven, would that affect our overall rates?
There's several programs that we have contracted with third parties for. There's a diabetes program, which is actually really well received. It gives people free diabetes care, free equipment. If people meet parameters of the system, going to their checkups on time, things like that. So there's that. There's a teledoc program
Yeah.
that person's enrolled in to try to keep costs down in terms of office visits. There are some wellness funds for general programming that we have access to. So we're always looking at wellness.
Yeah, 'cause I know Phelan used to offer X amount of dollars per year if a member was enrolled in a health plan or enrolled in a gymnasium or a
Right.
wellness club. And I hope that gets transferred to some of the other carriers.
Yeah, Fallon had the most generous benefit when it came to well reimbursements, that's for sure. But each carrier does have something.
And any indication why Phelan is leaving the commercial world? Are they hurting for money?
Cost of, yeah, it must just be a business decision. They're still going to exist, but not in the commercial market. I don't know what that looks like, but
Neither do I.
yeah.
I had them for years as one of the options, and they're very good in southeastern Massachusetts for the employees I had down there. And they absolutely loved the program. It was dirt cheap, and the care was fairly decent. And they loved some of the perks, like the gymnasium and all that kind of stuff. So, it'd be a shame if some of that stuff was given out.
Yeah, it's just the West Suburban Health Group's always been about choice, and it's too bad that we'll be with one less option.
Yeah.
And then the following year, actually, Tufts and Harvard are merging, so we'll likely they'll consolidate their plan at that time too. So
Yeah. Do we have many employees? Because Phelan was strongest, as I said, in Southeast. Do we have many employees living there in Southeast, or kind of where do they kind of find their home? Closer to
I think we do. We've seen more employees commuting a long distance
okay.
as of late. Some from Rhode Island.
Yeah.
So, yeah, I'd say we do.
Okay. Thanks.
Chuck, one last question from me. Do you anticipate any major recruiting to be happening for open positions in the beginning of 2022?
Sure, good question. Let's see, we have Director of Assessing that's currently out there. We had to repost after one of our few candidates backed out. So that's currently out there, closes soon. That's a really tough one. It's a really niche position. And what else? We have our Director of Design and Construction, Steve Popper, retired just recently, so we'll be having to fill that position. What else?
Are you going to backfill Mike Resky's position now that he's superintendent of water and sewer? Do you need to do that or no?
I think we have a project manager posted currently. Yeah.
Okay.
So that's out there. And then we had another project manager recently.
But that's related to the ARPA funding.
Oh, that's right.
Yeah.
Gotcha.
So that was a new FTE.
Yeah. What's starting rate for a project manager off the top of your head,
I'm sorry, what was it? What's the what?
Starting rate.
Starting wage for a project manager. The position you're looking for, what do you start in the salary?
It's a grade 10, which
I may have a couple people that throw your way.
it's a grade 10, which starts at 71,000, and the top of the grade is 99.
Okay.
Are you having any luck trying to recruit diverse candidates? I mean, that's one of the, objectives of Newari is to be sure. And the town has had a good record of trying to do that.
Yeah, we're certainly trying. We're trying some new avenues of job boards. We posted a number of positions on diversityjobs.com. There's a few other places that we've posted as well. So we're testing out some new job boards. One other thing that we currently are just started testing this week is our applicant tracking system. We haven't had an applicant tracking system to speak of. So it's been a very manual process, and we've been working through implementation and setup. Tatiana's done a great job getting that process through and getting us to this point. So we're currently testing 2 positions we have open.
Great.
Using applicant tracking, but one of the nice things about that program is that we'll be able to blind the personally identifiable information. So names, address, I believe it's school name as well, right, Tatiana? And we'll be able to do that on the front end. And so hiring managers will essentially look at a list, be able to click at each candidate, look at their what they filled in the application, but they won't see that information. And then once they've chosen who they'd like to come in for an interview, they would say, I want to pick these 8 candidates for interviews. And then we would open up the information so that they can contact those candidates.
Gotcha. What system are you using for applicant tracking?
It's called NeoGov.
Okay,
He worked specifically with the private sector, with local governments
gotcha.
across the country. So they're tailored to public entities, which is
Good.
nice.
Yeah.
But so we're hoping that does a good job at, preventing any unconscious, on the front end.
Right.
Yeah,
Excellent.
that's good. Congratulations on that. That's
Yeah.
gonna save you lots of time and energy, and also make you look good in front of hiring managers. So that's
We're very excited to
good for you.
complete the implementation process, yes.
Good for
That's
you.
great.
Yeah.
Good.
But yeah, that's something we're always trying to. And what else? We have reintroduced a self ID survey for the one for the EEO reporting.
Yeah,
Also to get some data on where we are currently in terms of the diversity of our workforce, and see if we can get specific data on departments, positions, and then to be able to compare that to the applicant pools we're pulling from. So the applicant tracking system will also have a self ID survey as well. So we can, at that point, we'll be able to see how well we're doing in terms of, are we getting diverse applicants?
yeah. You're required to fill it on one, aren't you? Or
We are every 2 years, and this year's a reporting
okay.
year, so that works out well too.
Yeah. There's systems out there that do that for you online. Once
Surveys.
once you track it in, it's there, and you can just add when you hire someone else, and you can pull all those reports for that EEO one real simply, and not have to go through the laborious stuff like I'm sure you're probably going to go through when you go to track that.
Yeah,
There's some pretty slick ones out there, and they're not all that expensive either.
that's good to know. It is a manual process right now, so
Yeah.
that would be worth looking into.
Yeah, I learned the hard way. When you're trying to do 2,500 employees, it's you figure out a way fast. So yeah, there's some good stuff out there,
Yeah, good. That's good to know. Appreciate that.
and there's got to be governmental ones too, right? Like not the kind of stuff that I would have bought. That's the same thing you're doing with your applicant tracking. There's got to be some municipal stuff out there.
I'm sure there is.
Yeah. Good.
The other thing is that with, not just diversity jobs, I mean, in terms of recruiting more diverse candidates, some of the positions that you talked about, those professional associations also have affinity groups, so sometimes
Yeah.
to look at the professional associations and their affinity groups or affiliated groups to seek out, a nice pool. So,
Mhm.
That's a great point for I remember for the library director, the ALA had the ALA Black Caucus. The
Yep.
ICMA has the International Association of Black Public Administrators.
mhm.
There's a Hispanic Public Administrators Association that's also a subchapter.
Yeah.
So that's a good point. Yeah.
Okay. Anything else you want us to address today, this afternoon? The 4:00 start time is throwing me.
And it's already dark too.
I know, I didn't want to get up to turn on the light. It's really dark.
Yeah.
That's
Oh, I woke
that's all
up
we
to
had.
4 inches of snow this morning. You get any snow there?
Oh,
No,
no,
it's
thankfully.
actually a beautiful day today.
Yeah,
Nice.
it was brisk.
Yeah, there was a little bit of a wind.
Gotcha.
All right, Joe, do you have anything? It was on mute.
He's doing cocktails.
All right.
There I am.
There you
No,
are.
I don't, except that I've got to run. So
Yep, okay,
Yeah.
so I think we're wrapping our meeting. If anybody wants to provide a motion to close the meeting.
yeah, I'd like
and-
to adjourn. I'll move to adjourn.
All right, Joe,
I second.
very good, all in favor?
Aye.
Aye, have a great Thanksgiving, be safe.
Thank you.
Okay,
Thank
you
you.
too.
You too. Yeah. Happy Thanksgiving.